guest is John Brownstein, New Frontiers, surveying Twitter feeds and other social media.
Great. It's fantastic to be here to talk to you a bit about our work in using new data sources to understand drug safety signals. And this really does follow quite nicely from the last few presentations in harnessing new digital data sources to understand what we call the patient phenotype. So the idea is that there's this huge amount of digital exhaust that we have that streams from us from our interaction with search data, with social media sites, our Fitbits, and all these tools both retroactively and prospectively paint a picture of an individual that's very unique and very different from traditional clinical data streams, and really has become a new data source that we've been tapping into. So of course, many different examples that have emerged: infectious disease, as you can imagine, many examples we've worked with, chronic disease, drug safety, which I'll talk about today, even new types of behaviors that might not actually reveal themselves in clinical data streams, drug abuse and diversion, which I will mention, and even patient experience, new indications of quality of care that are emerging from these sources. So our group has really been focused on thinking about how to harness that massive amount of quantity of information coming from all these various data streams to essentially organize that content, and the difficulty of organizing that in creating new taxonomies, new ways of interpreting. We heard from the last speaker how tricky that can be, and I'll show you examples of what we're doing to deal with that. But what we think is that in aggregate, these types of data sources can provide us really important early indications of population level issues, whether it's infectious disease, chronic disease, or drug safety signals. And even from the point of view of global health, we can actually get insight into populations where there's limited public health infrastructure or limited transparency. So we're really thinking about this at a global scale. When it comes to drug safety, we're actually really interested in the interaction of patients on social media, because we know that there's this broad set of adverse events that are taking place, and we actually only understand a very small fraction from the current traditional practices that we have in place. But the challenge is, and of course there are many tools that are engaging patients to report in about adverse events, but really patients, clinicians don't know about these processes, don't access these tools, and even if they did, they're very complicated. So our thought is, well, why not go to where patients are already talking about these issues and amplify their voices? So that's really been the focus of our work, working closely with the FDA, thinking about how to take what people say online about the products they're using and translate them to something that makes sense from a regulatory perspective. So even something as small as a tweet can have the elements that might resemble an adverse event: the drug, the outcome, the date, the reporter, all the elements that, if we can basically harness that information in aggregate, can be extraordinarily useful. So the challenge of that was sort of taken on by a tool that we developed several years ago, sponsored by the FDA, which is basically attempting to organize all that content together into one place. So the challenge is, of course, harnessing all those various data streams, trying to collect that public data. The fonts got smaller there, filtering that information, removing false positives. So there is actually a huge manual effort in curating this information, but that creates a feedback loop that goes back to our dictionaries, as well as developing statistical tools. We've heard some of the tools from Microsoft, and similarly, we've been applying some of these same methodologies. And of course, in the broader scheme, bringing this data and lumping it with other traditional data sources. So the challenge really comes right at the beginning in terms of developing a taxonomy that makes sense from a regulatory perspective. We heard from the last speaker that there are so many difficulties in taking that stream of digital data, whether it's typos, spelling variations, but in the context of social media, we have hashtags, we have abbreviations that we're having to deal with, and as well as implied phrases, things that you would never see in a clinical record, but are obviously important from an outcome perspective. And so we've been building this massive internet vernacular taxonomy over the several years now, trying to take all that information and then organize it across various coding, so Medra, SNOMED, so that we can take that digital exhaust and actually make some use out of it. From there, of course, we need machine learning tools, not only to identify outcomes, but to actually understand whether things are actually important for us to look at. So we actually have a huge corpus of historical data where we've tagged, and truly there are some people on our team that have looked at some pretty interesting text to code all this information. But the idea is, of course, using our training set to be able to then come up with a composite score for whether an event is worth bubbling to the top. But from that perspective, we're viewing this information. We can actually slide the scale to basically see what are the most important events. So from an FDA perspective, there's a tool that you can then select a particular product and then get essentially a dashboard of everything that's being said across all social media sites that we're collecting data from and attempting to look at potential signals or associations that are worth future investigation in other types of data streams. So just to give you a sense of the types of data that we're collecting, and once again, there's some font issues here, but we've collected about 57 million mentions of drugs. So that's quite a large data set that we're dealing with that no single individual can actually deal with. But we've curated a pretty substantial number of those, 380,000, so seen by an individual. And our precision recall still improving at 68% for precision and 88% for recall. The systems are getting better and better over time as our curation improves. So of course, there's a lot of research that's gone into this data. I don't have time to get into all the details, but generally the associations of what we see from fairs are similar in proportion to what's coming through social media sites, but there are some important differences. If you take something that's been on the market like Accutane for a long time, you'll see that important severe events may never come through some of these social media channels, but at the same time, maybe less severe events come through these channels where they might not ever get bubbled up to a physician. And so these aren't insignificant events, they might be less severe, but they're still important from understanding the product on the market. And what's also interesting is many people think about whether the types of events that would get reported are the ones that are just generally the more common outcomes that are, say, for instance, on the label. And what we found is, in fact, that many of the outcomes, even the super rare outcomes that are unexpected ones, do come through some of these channels. And of course, we're identifying many events that are not necessarily disclosed in the label as well. And this is in a paper in drug safety that we published last year, where you can get more of the details. But just to give you some understanding of the types of things that people are talking about, adverse events, of course, is a bulk of what we're trying to collect, but we're also identifying new patient benefits because one person's AE may actually be another person's benefit. But there are other types of interactions and important insights that you can get about products. Of course, product quality issues that are coming through these systems, diversion and resale, which I'll talk about in just a minute. And then product pricing, of course, where we understand there's massive variation in pricing throughout the country. And then something that, of course, many people are interested in is off-label use. And we're getting many disclosures of people that are, of course, using these medications in outcomes that they're not prescribed for. And of course, the idea is that we don't necessarily just want to get data that's from the social media site in itself. This also represents an engagement platform where we can actually, as a tool, actually interact with people online, and that's still understanding the regulations of what is possible. But of course, we can actually direct people into, this is the other FDA-sponsored tool that we've built called MedWatch, or the app, where people can actually give much more detailed information about the event. So we can actually get a lot more information from individuals by bringing them into a crowdsourcing tool. Many other data sources, I'll just give you another example of something that might be horrifying to people in the room. Instagram is one that we actually spend a lot of time looking at. And this is not from the adverse event perspective, but this is still individuals' interactions with products, mostly opioids, where in fact what we're seeing is an incredible amount of diversion that's happening. This is not on niche websites, but these are in plain view, very common social networks where people are actually diverting medications. And this is my favorite one. So from that perspective, we actually built another platform called StreetRx, where people are actually reporting the price they paid for products, for pharmaceutical products, and crowdsourcing the black market value of these products. And from that perspective, we have incredible data on what is upcoming, what are the products that are most in demand, and collecting that data and actually having a pretty good insight into the value of products, which, of course, as you can imagine, is highly related to the potency. So the more potent the product, the black market is very smart to that, the higher the street value. And in fact, we can see that that data correlates incredibly well with law enforcement data, and Silk was probably the first paper ever to use Silk Road data in an academic publication. But the idea and the reason why we do this, before you get too horrified, is that there is actually a value, a real world data value in understanding pricing, because, for instance, when OxyContin changed the formulation to something that was abuse deterrent, we saw immediately the price drop dramatically. And so we can use this tool to understand the public health impact that some of these products are having in the market and how changes to those products actually ultimately are reflected in the price. And of course, it doesn't stop there. We're now into dark web surveillance and the opportunities of looking at this data through all sorts of other channels as well. Many other efforts that are ongoing at the FDA and other products, tobacco surveillance, of course, so much is happening in terms of discussion around tobacco and even supply chain monitoring globally. So, of course, I think we're leading up into the discussion. Many discussion points to get into: causality, the volume, the massive quantity of information, who gets to own that information, who gets to play with it, signal detection, privacy. I'm sure there's lots of concerns in the room and worth discussion, and also the regulatory issues around this data as well. So I'll leave it there and look forward to discussion. Thank you.